Welcome back. Welcome back to Living in Mexico. I'm Ana Maria Salazar. Thank you. Thanks so much for joining us this weekend. There's a lot of political news to share, but also other news. And as you know, when the pandemic COVID-19 crisis was taking place, we made it a point to be informing and providing ongoing information. Well, there was a series of statements and confusion. There was a lot of confusion regarding a report that appeared regarding the occupation of hospitals in Mexico around the country, and of course, it created unnecessary anxiety and speculation. And as usual, when this information comes up, it's really important to try to understand what the Mexican government is trying to say. That's why I really appreciate joining us today, Dr. Mauricio Rodriguez. He is a professor at the UNAM University Medical School, and he's been joining us, I don't know, for the last 3 or 4 years. Doctor, welcome to the show once again. Just walk us through in regards to this
Yeah,
information that was published this week in regards to potential saturation in hospitals, and it just
yeah.
created all kinds of nervousness. What was that information about?
Well, thank you very much, Ana Maria, for inviting me again. The first we can try to describe the framework in which this information was given by some media.
Mm-hmm.
First, we have some isolated information from the United States regarding the activity of the
Right.
seasonal epidemic. And we
Mm-hmm.
are seeing some hospitals with their emergency rooms full of people looking for care. And
Mm-hmm.
also, we have some news from Spain and some other countries in Europe, but particularly from Spain, in which they made mandatory the face mask again
Right.
in the healthcare services.
Mm-hmm.
So that could give the impression that the activity of COVID and the other respiratory diseases is increasing. And some of the media reported that the occupation of uh, the there is a network in Mexico which reports the number of beds available for respiratory diseases,
Mm-hmm.
and they say there are some hospitals which are full
Mm-hmm.
with this kind of patients, but they did not report the number of beds which each hospital reports. So
Right.
they they don't know what's the universe of beds, and they
Mm-hmm.
didn't say that from the 600 hospitals that report their occupation, only 9 are full, and the
Mm-hmm.
other 50, 590
550. Yeah.
something,
Mm-hmm.
yeah, they are below 50% of occupation, which
Mm-hmm.
give us a clear impression of the situation. So
Mm-hmm.
in terms of numbers, we can say that this year we have 3.5 less hospitalizations than
Mm-hmm.
in 2023.
That's
So
important to. That's
that's
really important to underline. Yeah,
yeah,
that's really
because
important to underline.
there were 800 people hospitalized in January 2023, and now
Mm-hmm.
we have 250 people hospitalized.
See, there was also maybe you can explain to us. The UNAM came out with a press release regarding also I believe it was COVID. Can you just explain what the UNAM position is? Because I trust you guys, and kind of when
Thank you.
when you come out, I do, and I think a lot of
Thank you.
people trust UNAM's
Yeah,
information much more than what happened during the COVID
yeah,
19 crisis, because you all were very objective and medical. I mean, you
yeah.
tried to
And
avoid the politics behind all of
yeah,
this.
well, thank you for that. And what we said this week in a press release is that we are monitoring the situation. We do not see any sign of alarm, We see a regular season of winter epidemic as usual. Actually, we did not say it, but this observation that the hospitalization is 3.5 less than the previous year, and we are aware that from this point forward, we could see an increased number of people getting sick, and
the kids are coming back from the holiday season. It was kind of expected. That now, are you recommending to use masks?
We are recommending only if you are in a crowded place with poor ventilation.
Is this the classrooms, for example?
Could be some classrooms. And public transportation, of course, it is a place with these characteristics. A meeting room, perhaps an auditorium, but all the other places, it is not suggested. No, and we are just recommending that. Yeah, and we also are recommending that if you have any symptom of respiratory disease, try to stay home. Or at least use a face mask during your interaction with other people.
It is, I mean, like I said, it is the time of the season where everybody gets sick.
Exactly.
There's a lot of people around, at least my family, that have gotten sick, including, I think, both of my kids. But they haven't, they weren't positive for COVID. We did test them, or influenza. It's just, there's a lot of bugs out there. Now, there is more and more people that are getting vaccinated, are paying for their COVID-19 or their COVID vaccination. I don't even know if we call it COVID-19 anymore. But is that eventually, the number of people getting this new, do we call it a booster, or is it an updated version of the vaccination? And what impact could that have somewhat in the next couple of months, if any?
Yeah, well, we saw a small number of people getting the vaccine during the season which started in October, and for both influenza and COVID, and that could be because of confidence in vaccines, because of accessibility, because of any reason, and we know in Mexico the vaccination against COVID and influenza is focused on high risk groups, so we have to prioritize those groups to be vaccinated first, which is healthcare, pregnant women, people older than 55, and people with comorbidities or some diseases. No, those are who have to receive a booster during this season, and we know that any of the vaccines that is available, that are available in Mexico, are useful to prevent the severe disease and death from COVID. So if you can pay and you want to pay for a private vaccine, for a private sector vaccine, go and do that. If you don't want, or you don't, if you could not afford the vaccine in the private sector, you can go to the public sector and get the vaccines that they are using there. Both of the vaccines will be useful to prevent the severe disease, and neither the vaccines will prevent you from acquire the virus. So, which that is also important to mention.
That's an important point, because at the end of the day, you can get sick.
Exactly.
So, and I had this, and I had this kind of discussion with my children, because they're like, well, we already have, we've been vaccinated, and it's we don't have to worry about it. I said, no, you can still get sick, and which means that you miss school, or in my case, I miss work, and it is, and you miss family reunions. I mean, it does mean something. The issue is, you're not, probably, if you have the vaccine, which is, I guess, the ultimate goal, you're probably not going to die of it.
Of course.
I think. So do we have any sense of are people still dying of COVID in Mexico
Mm,
and around the world? I know there's the numbers in the
well,
United States
around the world, yeah,
are
but
complicated,
In Mexico is I mean, very few cases of that.
very low. Yeah.
Yeah, and actually,
And
hospitalizations also are very low.
mhm. That's definitely good news. So,
Yeah.
do you, in your experience and the information that you have access to, are people getting sick with COVID or influenza?
Well, what we can find in the Sentinel system, which reports this, is that
Hmm.
it is COVID, influenza, and syncytial virus, syncytial
Hmm.
respiratory virus,
Hmm.
the three most frequent viruses.
Hmm. Can you just briefly explain to our audience what the Shishi chill virus is?
Which one? The
The third one.
the syncytial respiratory is a virus that affect the youngest children,
Hmm.
actually younger than 1 year, and
Hmm.
they complicate with bronchial disease. And if you don't take good
They
care
get
of
very
them,
sick.
yeah, they can get sick.
Well,
And
as of course,
it
huh?
start it starts the same way than the others. I mean,
Right.
that is the point. Most of them start the same way, and you get all those viruses the same way. So if you
Hmm.
have symptoms, you have to protect yourself in order to avoid passing the virus to the people in your community. As you mentioned,
Right.
you will go out to school, you will
Hmm.
maybe you will stop working for some days, and that will
Right.
interfere with your work, and you will pass the
Hmm.
virus to the vulnerable people in the community, and that's
Yeah.
the highest risk.
Yeah, and it's still a responsibility that we should
Of
all
course.
be assuming.
Of
Dr.
course.
Mauricio Rodriguez, he's a professor at UNAM's medical school. He's been joining us throughout the years. I really appreciate you joining us as we initiate this 2024.
2024.
I really appreciate you joining us here on Living in Mexico. Thank you so much.
It's always a pleasure, Ana Maria. Thank you.
Thank you.